Assalamu alaikum, the communication day. First scenario, speak with Mr. Ahmed. He's 50 years old. You are the cardiology registrar. He was diagnosed with amiodarone-induced lung fibrosis. He was given repeated doses of persistent atrial fibrillation. Plan is to observe on repeated pulmonary function test and stop amiodarone. And multidisciplinary team arranged for further plans. Speak with Mr. Ahmed. Address his concerns. Yes. Here you go, Dr. Sarah.
Hello, I'm Dr. Ali, one of the doctor in the service today. Are you Mr. Ahmed, 50 years old?
Yes, I am, doctor.
Hello, Mr. Ahmed. We are here to discuss about your health condition. Is that okay with you?
Yes, Dr. Ali, it's all right.
So, Mr. Ahmed, to be at the same page, could you tell me, please, what do you know about your health condition?
I am actually having started to get this shortness of breath, and I wasn't. This was happening slowly, and a very bad cough, and I was really irritated with that, and I've been referred. I've been referred from the GB because of this worsening. I had also evidence of that there is lung fibrosis. I think the doctors were saying in the last admission in the heart clinic. I was admitted recently also before the GP. Yeah.
Okay, Mr. Ahmed, thank you for sharing this with me. Do you have any expectation from our meeting today?
Not really. Why I am here?
Yeah, okay. I will be explain everything for you, Mr. Ahmed. We are here to discuss about this. So, Mr. Ahmed, as you mentioned to me, you have I saw in your notes you have a cardiac, heart issue also, and you was in irregular heart beating, and you are in medication called amiodarone. Am I right?
Yeah. But I remember I'm not sure if you are in the same team, but the team has told me that they stopped that medication in the last admission.
Yeah, I understand, Mr. Ahmed. You were on medication called amiodarone for your irregular heartbeat, and you take it for a period as it was the best interest for your health condition regarding your irregular heartbeat. But unfortunately, this medication for some people can cause some unwanted side effects. And one of these side effects is called pulmonary fibrosis. I think you have been discussed
My
about this issue
God.
before. Am I right?
No, doctor, I am really in shock.
Okay, we'll understand for you more. I will explain for you more, Mr. Ahmed. What we call it lung fibrosis, it's like, sorry to tell you that it's like lung become scarring there because of this medication.
Yeah, I know the scarring, doctor, but I am not linking the things together. Is that because of this medication you are saying?
Yeah, I'm afraid to say you. Yeah, this is because of this medication you have been taken for your heart problem before, Mr. Ahmed. But this medication was given to you as a best interest for your condition, and we give it for many other people, and not all of them can suffer like you or can express this lung scarring like you. But I'm sorry that you have this lung scarring, Mr. Ahmed.
Doctor, but this is I'm quite angry, doctor. Why? So why I don't know about this? It's not one time only. As you know, the GB also mentioned that this has been given many times, and not in a single admission I have been informed about this.
So, Mr. Ahmed, you mean nobody explained to you this side effect for this medication before?
Yeah.
Regardless, I really apologize in behalf of my team, the whole team, because this is not the usual practice for us. Usual practice for us, we sit with anyone and we explain this medication, it's taken for what is the possible unwanted and side effect. And whilst it's not done with you and nobody explained for you, I'm really apologize for this, Mr. Ahmed. Please accept our apology. And
Okay.
regarding this medication, we will just stop it while now, as it's causing scarring. And we will just keep you under a group of doctors and specialists. And we will just under lung doctors and specialized nurse and specialized team and what we call it respiratory rehabilitation team. And you will be under a regular follow-up with that. We will just follow you, your lung, what we call it lung function test, that it will reflect us your lung, how does it work. Are you following me?
Quite a lot of things happening. So so will my fibrillation become manageable again? I
I
mean, that
appreciate.
medication was really good, but in the same time, I didn't know before this fibrosis thing.
Yeah, I understand your point, Mr. Ahmed. Regarding your heart problem, irregular pulse, yeah, our consultant will put you on another medication. And before you're taking this another medication, we will sit with you and explain everything about this medication, and it will be discussed with you. And the possible unwanted effect can be happen also with the other medication, Mr. Ahmed. Don't worry, let we will let we will not let you go through this alone, Mr. Ahmed. We are here to give you all the help you need. And also regarding this, you told me that the medication given to you without explain everything about it. I mean, the amiodarone. We will also raise what we call it incident report, and it's like special report. We will raise it to a specific team to investigate and to know what exactly happening to avoid to happen this again with you or with others. With others, is that okay?
Okay.
So, Mr. Ahmed, do you have any other concern?
Will my fibrillation become worse?
Yeah, I understand your worries, Mr. Ahmed. Um, um, your heart problem will be under follow-up and treating by our consultant, the heart consultant, and he will put you on another medication to control this abnormal heart beating you are suffering from. We will not just stop amiodarone and keep it without any treatment. And if it's like you, you can't just handle any medication, there is another options also can our consultant give it to you, Mr. Ahmed. Is that okay?
Okay.
Do you have any other concern?
2 minutes left.
I'm actually quite impaired in my ability to go to my work with this shortness of breath.
Yeah, I appreciate your worries, Mr. Ahmed. If you need regard now, we can just offer for you some sick leave and till you get improvement, and also we can refer you to social health worker. He can help you regard this, Mr. Ahmed. Is that okay?
Okay.
Okay. Do you have any other concern?
No, thank you.
Okay, so Mr. Ahmed, I will ask you some few questions. What do you
Yeah.
do for a living?
I am office, like you can say, secretary worker.
And how much that impact your work and your life?
Pretty much, actually. I can't go to work with with these symptoms.
Sorry for suffering, Mr. Ahmad. We will just refer you to a social worker. He can help you regard this. With whom you are living, Mr. Ahmad? Do you need any help at home? Are you supporting
No,
him?
it's no, I'm my family is supporting me.
Okay, if you need any help of any kind of support, just tell us. We will be so happy to give you this help.
Okay.
Do you smoke?
Oh yeah, I smoke actually. Thank you for asking. 10 cigarettes
I highly
every day.
Okay, highly recommended you, Mr. Ahmed, to stop smoking as it will affect your health and also on your lung and keep it make it worse. If you need, we can refer you to what we called it a smoking cessation clinic to help you regard it. Is that okay?
Okay. Thank you.
Do you drink much alcohol?
No,
Okay, good. Do you have any other concern or queries, Mr. Ahmed?
no, thank you.
Okay, Mr. Ahmed, I will provide for you some leaflets and brochure to read about this amiodarone and this, what we call it, lung fibrosis. And if you have any queries or questions, just contact us, Mr. Ahmed. Is that okay?
Okay.
Okay,
Thank
time
you.
is up. Well done, Dr. Sarah. Dr. Abdullah, can you comment?
I think so. First, you were defending the first instance of the patient who was like shocked from his. He really got a bad diagnosis from a medication. So you were defending initially the first sentence, which like initially you better to be try empathetic first.
Okay.
Just a second. Wait.
Dr. Abdullah, you're busy?
If you can give me 10 seconds.
If you're busy, let me comment on this part, then you can come back. Okay? Okay, let's see. Let me comment on this part, Dr. Sarah. He said to you, I am shocked with this news. And what you did, the reaction or your reaction was explaining the disease. Okay, what the aim of the golden silence and the
Okay, yeah,
good,
I'm
yeah.
back.
Okay.
Doctor, but actually, Dr. Abdullah confused me. He came with a diagnosis already. He told me that I know the GB told me I have lung fibrosis. That's why I didn't just, it's not shocked for him. That's why next time he said, oh my God, I'm shocked. Yani, I didn't know what to do because he's already
Okay.
told me I have lung fibrosis. The GB already informed me, and then he's just shocked. He shocked me.
Yeah,
So,
the answer was unexpected. Okay, Dr. Abdullah, I can comment. Sorry.
like, the patient told you that the GB didn't tell him that the medication was the reason for his lung fibrosis. He just got lung fibrosis, and we don't know. The main impression was that it's due to amiodarone. So the GB referred him, and also cardiology aware about that, but the patient was not disclosed about this medication is the reason of his issues. So that's the main reason of this sitting and the meeting with you. So he knows about lung fibrosis. He's shocked about the medication is the link, not the diagnosis.
So why should I do silence, golden silence here?
Not like silence. I'm not saying la silence. You are no. It's I mean
No,
about
I mean,
the
Dr. Bassam said, where is the golden silence? That's why I couldn't just join together.
no. So the main issue is that
I will comment later on. Okay, continue, Dr. Abdullah.
so a medication induced lung fibrosis. The patient had uh, frustration, you can say, from the medication causing him adverse effect. So it's not as a golden sinus or full breaking bad news in this case, but you defended him. I mean, they defended the decision in the beginning. You said, I think you said it was, yeah, repeatedly, it was given in the best interest. Yes, you are right. But in the same time, it was given in the best interest, but try to be empathetic in the way you are saying that
Oh, okay.
more.
You
Just
mean the
that's what
tone?
I'm saying.
Oh,
Yeah.
okay. Okay, I get it.
And also the uh, like try to stand with in the middle ground. So you said yes, we don't know, like you can say I'm sorry for you said that you are sorry for that you're not told about this medication. I am really sorry. More than that. So like you were just okay, sorry, regardless what you like we are like okay, um you had this fibrosis and we will stop the medication and like a plan of you're listing the plan of things, more information on the patient, but it's just he wants the sorry from you. And
I apologized 3 times, not just sorry. I said sorry for lung fibrosis, and when he said nobody informed me, I apologized many
okay,
times.
good, but the tone, okay, the tone, I think the main issue.
Okay.
The other thing, you didn't clearly say the reason of the MDM. MDM was mainly to arrange further plans. So they will discuss what is the best for his atrial fibrillation after the Myodarone. Because you don't know, it could be medication. They could have the ablation studies, for example. So you don't know.
I
Uh,
said it. I said that the consultant, our consultant, heart consultant, will just provide you another medication, or
okay.
maybe if you're not tolerated with the medication, we can give you another options. I mean the ablations and so on.
Okay. No, you said the cardiology consultant, which is like he as a one consultant, although it is not one consultant decision. It will be a group of MDM. They will discuss the plans for him and they will arrange that meeting so that he knows the benefit of that meeting. Okay.
Okay.
And it's also you had I asked you a question, I think, but I forgot the question. I asked you a question, but you didn't answer me the question clearly. The first question, which is will my atrial fibrillation become worse? So I needed to ask you this question twice, and then you answered me the question. Uh, you answered me the question later on. That's like okay, we don't know. There will be alternative medication. We will make sure it's good for you, and that's I think gives some answer, but I'm not sure the best answer in this scenario. Will my atrial fibrillation become worse? So I think it's up to the cardiology. They know better about this. The other
We are
thing is,
cardiologists also. We are in the cardiology clinic,
oh
so
yeah,
it's up to us.
here's the difficulty. Yeah. Okay. The only one thing remaining. So these issues are not a big thing, Marks. You were doing well overall, but these like small notes I wrote. The other thing is that
Okay.
the uh, is yeah, you gave brochure about Amiodarone, which is like I think too late for the patient. Already he will be stopped from this medication. But it will be no, you are right. It will be good for him to know. Oh, you should explain the lung fibrosis could improve after this medication stopping, as this evidence as
No,
evidence.
I have one point about this. While it's fibrosis, scarring, it will
Ah,
not
once it's
improve.
fibrosis, once
But
it's
if it's
fibrosis.
pneumonitis, it's okay. He
Okay.
will just reverse and he will improve and everything will be okay. But while it's written fibrosis, it's a scar. It will not improve.
Did you refer the patient to? Did you say we could discuss with the lung doctors?
Yeah, I said as a multidisciplinary team, lung doctor and respiratory rehabilitation
Okay, good.
center.
Yeah,
Yeah.
You did that. Okay, that's it. Yeah. Dr. Bassem, do you have any? Please enlighten us with more.
Yes, I was commenting on the part of the patient reaction. He was shocked, but he ignored his shock or his shocking and start to explain. Uh, I think by mistake she
Um.
didn't hear you well. I think so,
Okay.
Doctor. So
Yeah.
whenever the patient react, Doctor Sarah,
Yeah.
anytime patient react, give him chance to say what he want, to express
Okay.
what he's feeling. Okay. I think you interrupted him
Okay.
immediately and you start to explain. I said earlier, so whenever you have not only breaking bad news, even in this scenario, like in this scenario, I meant that it's not a breaking bad news because it could be reversible, but I mean, or I meant that if you have patient or surrogate start to react, don't interrupt him. It's a very
That's right.
negative comment, or they can minus you, like you are interrupting him. So what to do?
Yeah,
Let
you know,
him.
doctor, it's just he just mentioned to me the background. He's knowing about lung fibrosis and everything. I thought it's already done, and
No,
then he just
yeah.
again put it like error. You know what I'm get?
Yes,
يعني,
yes.
it was
Actually,
like
the scenario was confusing. I agree with this. And I think Dr. Abdullah also confused you more when he said to you that he knows the fibrosis, but he didn't correlate it with the medication, which is also doesn't make sense. How he knows about the fibrosis, the same person who will give him information about fibrosis supposed to tell him because of the medication. How now he's just wondering because of the medication? I didn't understand the scenario well anyway, but the aim of my comment that whenever the patient or surrogate start to react, let him finish everything. Even sometimes they are crying, by the way. You can have professional actors or actor who will cry, but don't continue explaining without reacting to his expression. You can even ask for tissue, please. Can I have a tissue for him? A cup of water, and the tone will be lower than the expected one. So you will reduce your tone, as Dr. Abdullah said, to show some empathy to him.
okay,
This is the way how to. Otherwise, I think you can understand and you can communicate well. Apart from this
okay,
scenario, which is a little bit confusing, but you know how to address. Whenever there is a decision not related to you, and it's written there, you can say, "We will have a meeting." Particularly those questions with difficult answer. Okay, practically, Dr. Sarah, I will ask you, or theoretically,
mhm,
if the patient is having amiodarone-induced fibrosis at the early stage, what do you think
mhm.
the medical action will be?
um,
Regardless
stop
the
medication.
legal. Okay, stop
Stop
medication.
medication. Yeah,
Legal, we already mentioned apology and so on. But what the medical action?
you mean getting given steroid for him? But
Perfect. Yeah, it's not your task here, I know, but put it in your mind. He might ask you, doctor, is there any medicine can improve my lung scarring? So you can answer this, but at the same time, take care of your role in the scenario. Your role. If you are working
yeah,
as cardiologist, you couldn't say that. Or you can say, I will refer you to the chest or lung doctor. He will be in a better position to answer this. If he says
okay,
something related to the cardiac or cardiology point of view, you have to answer it if you are the cardiologist. If the opposite, he will say, I will refer you to the heart doctor. So it depends on your role. And if
mhm,
you are not sure about an answer, you can say what I said. Theoretically, again, early stage, which is ground glass. Sometimes they are giving the steroids as early, and it can help. Or if at late stage, which is difficult to be having a case like this because it will be a very fatal mistake to start the amiodarone till the extent of honeycombing. But it might be there, or it might be associated with underlying pathology. Anyway, both of them, if the patient doesn't know or didn't know about the possible side effect, you have to apologize. Okay?
yes, doctor.
Yeah. What medication can improve or any alternative? If you are the cardiologist, either to tell him we will find another suitable medication, or you can say I will refer you or I will call my senior or my consultant if you are not sure about the answer. The take home
Because
message,
it's
yeah,
not mentioned in the scenario, the
exactly.
alternative. That's why I couldn't say anything. I just
The
I
problem
will
here,
just
the problem here,
consultant. He will decide.
exactly. But the problem here, they put the responsibility on you because you are the cardiologist. And
Cardiologist. That's why I just refer it to the consultant. He will decide.
or you can say in a best way, as a diplomatic answer, the multidisciplinarity. It's one of the answers, one of the point here in the scenario. Plus, there is a co-meeting for this decision. It's not one decision or one side decision. It's the cardiologist along with the pulmonologist. They will check which is suitable for the patient, and they will start it for him. So it's a safe answer to say multidisciplinary or group of doctors. They are sitting together to find out what can we give to you. It's easy
Okay.
and safe answer if you don't know even the
Okay.
information. Okay.
Okay, doctor. Thank you.
Okay.
Uh,
Thank you.
Doctor,
Yes. Yes.
should we do here the root analysis also?
Actually, where the mistake happened, after that you can
Ah,
address. Is it
okay.
GP? Is it the cardiology clinic here? Okay. So revise the medication again. It was prescribed by whom?
And should we
Diagnosed.
say when like okay, we know here it's the medication to to blame, and we know the patient was not told, but we don't know, as you said, where exactly the error, like where. Um,
Yeah, if the same hospital,
mm,
okay, started a couple of months ago in the same hospital, here you have to raise it. We should know what happened, why exactly you didn't been informed about this side effects. As Dr. Sarah said, it's not our habit. We usually mention everything to the patient. Why there
okay.
was a lacking information? We have to know that to improve the service, improving our quality, not only for you, for others, and so on. We can also investigate to know why exactly this happened. Okay.
Yeah.
Okay. Can you send the scenario, Doctor?
I already send it
Yes. Okay.
there.
Speak. Sorry, the scenario down. Patient, Mr. David Walker, 63 years old. You are the gastroenterology resident. Mr. David Walker was referred by his GP for 4 weeks with dyspepsia and weight loss. His initial colonoscopy wasn't successful due to poor preparation and tortuous colon. Today, he is scheduled for another colonoscopy, but he reported poor tolerance to the colon preparation and would like to avoid going through the previous experience. The consultant decided to go for CT colonography as an alternative initial test and would like you to explain him this to the patient. The task is to explain the current management plan to Mr. Walker, answer any concern he might have. Perfect. Okay. 2 minutes, Dr. Abdullah. We might open the
Okay.
discussion now for a while. Anyone commented initially? No one? Okay. Anyone want to ask or comment?
Dr. Basim, I just wanted to ask
Yeah.
a little bit about regarding this scenario, the first
Yeah.
one.
Uh-huh.
I mean, it's written that in the scenario he was given repeated doses for persistent atrial fibrillation. So I think that this sentence I am unable to understand because amiodarone is a treatment for
Yeah, long term.
whatever. Yeah, so it is not kind of a, it is not digoxin that
Yes, you're
you
right.
just giving. So I think that's a, I don't know what exactly does that mean. So I couldn't understand. Secondly, it is not a medical error. I mean, any medication which you are prescribing to the patient carries certain risk. So you just need to, as a doctor, you need to weigh the risk and benefit. And when you are starting certain medication, you just need to tell the patient that, okay, this is a medication which is beneficial in your condition, and these could potentially be the side effects, and that's why you generally monitor that as well. So my point
Yeah,
is that it doesn't come under a scenario of a medical error. There is no need of any kind of a root cause analysis or putting up an incident, because I think that Dr. Sara mentioned that we'll put in an incident and we'll investigate. I mean, you're
no,
not going
doctor,
to.
the error, it's not the side effect or the fibrosis. The error because the
Yes.
patient said nobody told me.
Yes.
And this is the error here. The patient should be have the full picture about this medication he will take, what is the advantage, what is the disadvantage, and the side effects. And if nobody tell the patient that, this is the error here, not the lung
Okay, all
fibrosis.
right, okay. So
Lung
because,
fibrosis is a side
right,
effect. Okay.
okay, all right,
At the
okay.
beginning, I said, I'm sorry, because this is side effect. But when he just tell me, nobody informed me about this medication and this side effect, since that, I start as a medical error.
Right, right. Okay, but as I said,
Mm.
that basically, I mean, if you approach this scenario when you are outside and you have 5 minutes, so I think it will mainly come under a kind of a breaking bad news that patient have to be told about that. Yes, the patient knows. I mean, obviously, this was also a little bit confusing that the patient was already aware that he had a lung fibrosis, but he wasn't aware that it was amiodarone. So, generally, I mean, in the exam, you do expect that the patient will know nothing and you need to explain the results and tell that it is due to amidron and then any. So I think that, yeah, okay, that's fine if you are, I mean, going for it, because otherwise incident report only for that is not required. Yes, if he was not told, so it is a kind of thing that the patient need to be explained. It is the same thing as we do for warfarin. Like if you are going to start someone on warfarin, so you need to counsel him up about the side effects, the interaction. So if not being told, then yes, so in that case you need to put in an incident form. And
Yeah,
regarding management,
that's
yeah,
the point here.
yeah, and regarding
Yes.
management, obviously, if the patient asks you directly, will it get worse? And you are a cardiology registrar, so you can say that yes, it can get worse. And obviously, we are in a difficult situation because you are on a medication which were controlling your symptoms very well, and the side effect, which generally
But
is not a.
doctor, if I said yeah, it will go worse, I will put patient in stress. But maybe patient he will put in
No,
another medication and he will not
mm,
go worse.
I mean, you see
That's the
that
point. Okay,
yeah,
our
the problem.
consultant will put you on another medication and maybe you will not get worse. There is another alternative than
Yeah,
Amiodarone, I
I mean,
mean.
my point is that if someone is asking that, will my atrial fibrillation go worse? So I mean, because if you are going to start him on another medication, so you still need to be, I mean, pretty clear on that. It can get worse, but yes, we are going to evaluate you. We're going to have a multidisciplinary meeting as well for you, and we're going to put you on another medication, and we need to keep monitoring you just to reassure the patient because it can get worse. I mean, if the patient was very well controlled, you cannot guarantee that the other medication, which might be something like a sotalol or whatever you are going to start him,
Yeah,
it
we
will,
can say
yeah. So you
it's a
need to tell that
possibility, but
it
we will
is a
not let you. Yeah,
possibility. Yes, you cannot
yeah.
say. I mean, the problem. I mean, the exam is that I have seen a lot of feedbacks as well that if you deal it like this, when the patient is asking a direct question, will it get worse? And you say that we are going to start you on some other medication and hopefully that will control. So they at time respond and give a feedback that the doctor did not address the concern directly. So when there is a direct question, my point is that when there is a direct question, answer the question honestly and directly. Yes, it can get worse, but what we are going to do, we are going to start you on another medication, and we're hopeful and we'll keep monitoring you, and we're hopeful that medication will work as effectively as the amidron. So just to reassure the patient that you are, although he is not on amidron, but you are going to give him further medication and you are going to keep him in the follow up just to make sure. So it's a kind of a reassurance kind of a thing so that the patient does not feel that he wasn't listened to. Because even Dr. Basim, you remember you were telling, and I have seen one or two feedbacks as well, in which this mentioned that the doctor did not ask about the concern. So what happened is that a lot of us, I mean, just as a habit, when we finish and in the concern, when 2 minutes left, we say, "Do you have any question for me?" So, I mean, some of the examiners they understand, okay, the question mean concern, but some of them they want the word concern. So they, because in their checklist it is that how effectively you have dealt with the concern. So my point is that we need to follow the checklist or the exam key as per what is written. Questions,
Okay.
asking questions. So I think that's something which I feel
Yes,
that
yes.
that was more appropriate. Yeah. Otherwise
Okay.
it was
Yeah.
okay. Yeah. Yeah.
Yeah. Let me comment on these two parts. So the first one, not all task will be single task. Sometimes you have hidden idea. It might be raised during the discussion only. It will not be written outside. For example, in our scenario today, no one informed me about this. Here, immediately, you have to deal with this as a medical error or mistake. Someone wasn't informed about a side effect, this is a clear error, right? Because it's not our usual habits. Usually we are doing the opposite. This is the first part. So you have to, if you have time, you can fulfill the all steps of medical error. If it is one of the parts of the component of the task, no need to go through. You have just to apologize and tell him we will see exactly what happened and we will try to solve it and to investigate more about it. Skip to the next point. Whenever you have a clear question, not only Dr. Sarah, anyone, and the answer is yes or no. So he's asking, do or will I have or do I have any question? The answer either yes or no. If you want to answer it indirectly, you have again to answer it, even if you twisted the answer. As Dr. Hasham said, yes, I am afraid to say that. However, it could happen. So it's difficult to do, however, it will happen. And in our scenario today, I'm afraid to say, yes, as long as this medication was controlling your arrhythmia or how awareness of heartbeat, I'm afraid to say it might worse again, yes, and we will try our best to make it controlled as much as we can. So always address the concern. Honestly, if there is something to be hidden, don't hide it. You have to answer it, okay? Even if it's not as the patient wish. Yes, all of the patient and surrogate, they want you to reassure them. But if the complication will happen, tell him it might happen. So be honest, don't hide, and try to answer it clearly. This is the take-home message from this point. Okay, thank you, Dr. Hacham, for reminding us regarding this point. I hope, I think also Dr. Sarah did well, but maybe this part need to be clarified for all, not only you, Dr. Sarah. I'm not saying it for you. I'm saying for all of you.
Okay,
Let's
thank you,
start.
doctor.
Yeah. Okay. Thank you, Dr. Sarah. Let's start. Dr. Abdullah, ready?
I'm ready. Yeah.
Yes. Here you go.
Hello.
Hello.
Uh, I'm Dr. Abdullah. I am one of the gastroenterology resident. Is this Mr. David Walker? And you are 63.
Yes, yes, doctor.
Um, Mr. Walker, I hope you are not waiting too long for me.
No, doctor, it's okay.
I am here to discuss with you the plans of management, and I understand there has been recent frustration and issues. Could you describe to me in a little bit what do you feel and what happened?
No, doctor, I just feeling that discomfort in my tummy, and I noticed that my weight is loose. I came to a gut doctor, and he just planned for me what we call it camera scan or something. I prepared myself and I went for this camera scan, but they said it's not well prepared and then just put me in another appointment. I came again, but I don't want to express this, to go through this again, doctor.
Yeah, okay. So again, this is actually like being like a repeated thing, and it should be there has been difficulties I see with the camera test, um, and I understand the first one you've been informed about. What you have been informed also? What do you know
About what, doctor? I didn't get you.
about the camera test and the difficulties?
I don't know, doctor. They are just maybe searching for something, maybe cancer or something. They said
Oh,
it's possibility there.
okay. So also, so as you know, we usually tend to we need to investigate, and there are there is the option of the camera test, which is a good option, but in your case, there has been difficulties, and there has been the first one. There was it needs preparation actually, as you said, because in order so that they can see well inside the wall of the I want to draw for you also to explain more. So this is the
Okay,
wall,
doctor.
large bowel, large back passage, and with the camera test, do you have been informed about the camera test?
Yeah, doctor, they informed me about everything.
Okay, so the camera test, in order to see well, it should be like almost empty from the from the from the stool, and then the preparation that you had a little bit difficulty to tolerate. Uh, Also, in addition, the preparation was not adequate. That's the
So,
So that was a difficulty in the first instance. And then in the second time, also you had difficulty to tolerate. So we will not do this procedure. We will not do this camera test. Our consultant decided that we will proceed with another type of investigation. Can I proceed now?
yes, yes, doctor.
So this investigation, it requires a, a CT scan, which is type of scans through the that will have will have a dose of actually it will give a radiation. I mean multiple times of the X-ray, simple X-ray.
Yes,
So
yes.
this one, almost 400 times radiation of the X-ray. It gives the slice image, a slice.
Oh, doctor, it
Yes.
looks serious. Why you will put me on this high radiation?
Yeah, I need to inform you that this type of scan we are planning it can give the risk of this radiation, but it's not the degree of being um, more like leading to cancer. It will be, although giving radiation, but it will be very important in your case to see why you are having these symptoms and to look inside the large back passage.
So,
As
doctor, you will just not do for me that camera test and you will just give me that what we call it CT?
so
And is it enough?
I will explain more. So it will be a CT along. We will give with it a type of coloring substance in your back passage that will be like you can say it will be given to you through your back passage in a in a it will be given to you through the back passage, and
Okay.
then we will do these scan along the when that coloring substance is inside your back passage. So that will be all arranged in a way that you will be. We need also to inform you about um, if that we need to inform you that you may um, you may feel discomfort from the back passage, but it's something tolerable. We need to give you first, before all this, we need to give you some painkillers if you want more something to make you drowsy if we need it to, because there will be discomfort. Is that
What do
all
you
right?
mean by drowsy, doctor? I will just lose my awareness?
It's not loss of awareness. It's not like a big surgery. It's not like a general surgery, but it's something to make you not feel the pain, because there will be this coloring substance will be given through a tube in the back passage. So
So,
you
doctor,
will
is it painful? I don't want to go through this. I don't want.
it should not be painful. We can give you we can give you substances in your vein, in the blood circulation, I mean, you have a cannula. We need to make sure you have a cannula, which is like to have access.
What do you mean by cannula,
I'm
doctor?
sorry. I'm sorry. I need. I mean, access to your blood channels. That will be inserted, and then we will give you some. We will give you this substance. We will monitor your vital signs and your blood pressure, your heart rate, breathing, and you will be observed. You will be given. You, you will be monitored, and there will be a whole staff of nurses preparing you. And
2
So,
minutes
doctor, you
left.
mean you will admit me?
No, this can be done in a day case, but I'm not sure. This is done in the radiology. We will communicate with you about this about before it
So,
happens.
doctor, this scanning didn't need any preparation like camera scan. So I can eat and drink whatever I want. No need
No,
to be fasting and to take this material
no, you
for
actually.
preparation.
No, actually, you will need to be fasting at least 6 hours before. So they will call you before. They will. You will be arranged that you will be fasting from overnight, and then you will come in the morning for this procedure.
But no need to take this substances for preparation, this
Yeah.
bowel, I mean the gut.
No, I'm not sure about this piece of information, but I will check with what we are doing, the instructions, and I will get back to you.
Okay, doctor, thank you.
Okay.
So this scan, it will just give me the diagnosis like the camera scan?
It's a good question. Actually, it will have less benefits of so we will not be able to take a piece if we needed to but it will show us actually in a clear way also.
So, doctor, if is it showing in clear way, why you just put me in stress because of this camera test? It's really horrible. Why you didn't do this
Okay.
from the beginning?
There was difficulty in your case because of this twice time procedure, and you were also have the large bowel in your case, large back passage. It was not straightforward. It was, you can say, the structure was little bit tortuous, you can say. So that was difficulty, actually, technical difficult and procedural difficulty with the camera test. So the decision this came because this actually will be preferred in your case. Do you have
So
any other
you
question?
see it's preferred for my case. Why you just put me in that camera scan?
Because
From the beginning, you can just do this scan for me.
we start with that because that has a more advantage. It is better actually for reaching the diagnosis, and it will be more advantage. But in your case, we got to the second option. Is that all
Okay.
right?
Okay.
Do you have any allergy to any medication or contrast or coloring substance?
No.
I can give you this brochures for more information and our contact number. And I
Okay,
will
thank you.
discuss with you later about smoking and other your social and home issues. Is that all right?
Okay. Okay. Time is
Okay,
up.
doctor, thank you.
Dr. Sarah, you can comment now.
Okay, Dr. Abdullah, well done. Regarding the introduction, actually, you started as like history taking, and could you tell me what do you have and you introduce yourself, you ask about the identity of the patient. At the beginning, you should just please tell me what do you know, not just, I don't know, you just give it like history taking. Another thing, you didn't ask about the expectation.
Okay.
Third comment, I feel it's like one-way conversation. You just keep talking. You didn't give me any chance to raise my concern. So next time, please, at the middle, just keep it. Do you have any other concern? Do you have something to ask? Do you want me to clarify anything? Because you just keep talking all the time. I couldn't raise anything of the concern. Fourth thing, doctors, you just use some jargons. Try to be careful about this. At the beginning, you said, I'm the gastroenterologist. I don't know who is gastroenterologist here. You just, I'm the gut doctor, or I'm a doctor in the service, or I'm a doctor in clinic, or what. Keep it open, better, if you will forget. Also, when you write, this is alternative, just write the advantage, and then if I ask you why you just put me in the camera scan and you didn't do this, you can raise also the disadvantage. Advantage of this, yeah, it's not invasive. It will be like scanning, as you said, but it's better to not mention the radiology. It's like X-ray, and I don't know how 100 times more than it, and blah blah blah. I think it's just, you will scare the patient. I don't want to go through this scanning. You can just keep it simply, as there is a modality of a scanning. It will show more details, but doctor, also you said you will give you a coloring substance. It's not coloring substance, it's air. It's carbon dioxide mainly. And it's better for you to draw. Yeah, you already draw. Just draw the colon, and then there is a tube will be inserted through your back passage till a point. It's mostly will be to sigmoid colon, and then the gases will be injected there to dilate the colon, the large gut for you. And we can see it, take this scan as a 3D scan. It will show all the wall from all the sides. And if there is any abnormal growth, if any possibility of the cancer, it will be seen. And also another advantage for this, over the colonoscopy, we can see also the extra colon side. I mean, if there is any abnormality from the other side of the colon, or from other parts, we can see also. But the disadvantage here, when I said why you didn't do this from the beginning for me, you can say the disadvantage here, because if we found something suspicious, like any cancer or tumor or polyp or something, you will go for colonoscopy again. As the colonoscopy will be needed next time if we found something by this CT. Got it? That's why we just put you in the camera scan from the beginning, because if you found something, we can just remove it, and it can be also like therapeutic also. If there is just polyp or something, we can just treat. At the same time, we can remove this polyp. So the colonoscopy also can be like therapeutic and diagnostic at the same time. But here, no, just diagnostic. We can see the lesion, but we can't do anything unless we will do another colonoscopy again. Regarding the preparation, yeah, this also CT need to be prepared like colonoscopy. Yeah, maybe less restrictions, but also he need all the preparation of colonoscopy. He will take the laxatives, and he will just prepare as he will go to colonoscopy. Maybe he will be allowed to drink something but it's not like, no, just fasting and go for CT. No, it's not. It's also need to be empty colon for this scan. That's all. And social history, you didn't ask anything, doctor. This is my comments.
So
You should ask or advise something, anything, or just ask about the impaction of life, or offer help, and just say something for social, doctor,
there
if
was
you have no time.
hinted to that in the last sentence, so that I let
Yeah.
them know that
No, I mean, you can just said if this impact you too much, we can offer for you some help, like social, like I mean, if you know no time, but at least just offer some help for patient.
Okay.
Okay, thank you, doctor.
Okay,
Thank
thank you, Dr. Sarah.
Thank
Actually, Dr.
Colonography, this is the first time I work about this, so thank you. Yeah.
Welcome.
Yeah, it's good to practice something you don't know. Maybe it will come to you in the exam. But I will start my comment with a question, Dr. Abdullah. But I think you answered part of the question. Did you convince the patient? Do you think you convinced her or him?
Yeah, Dr. Basal, I will just interrupt you. Sorry for that. Dr. Abdullah, you didn't tell me about the consent. You didn't write the consent at all.
My God.
This is like, it's procedure, during and after. You just tell me pain and we will give you some painkiller. I am sedation
Yeah.
and I don't know what. You just keep it like this approach: pre-procedure, during and after. Keep it simple, and then consent. You should raise the consent. You didn't raise it.
Yeah.
Okay, Dr. Bassem.
Yes,
Sorry
okay.
for
No,
interruption.
no, it's okay. It's not only the consent. I think maybe he answered this. And I wanted to ask him, how do you think about your performance in this case? He answered part of this question when he mentioned that he was confused about, or he didn't know about it before, about the CT colonography. Anyway, don't be confused. Whenever you have something you didn't practice before, just try to do it in the same steps as Dr. Sarah said, before, during, and after. And up to your knowledge, use what you know, even not in details. Okay. The jargon, I think, yeah, the whole scenario was full of jargons. I'm so
Yes,
sorry to say that.
yes. I
I'm
noticed that
talking
also.
honestly, Dr. Abdullah, because your exam, I think, next week. So please, please try to be more simple. By the way, from the beginning, the examiner will know that the performance will be good or no. Once you said, I am the gastroenterologist, resident or registrar, the examiner will know that you will do the performance of this scenario, I will say, not good. Why? Because first of all, it was jargon.
Mm.
You complicated the things when you said resident or registrar, or the surrogate will not care what's your position, what's your specialty. Yes, he might interest for that, but if you are confused with the position, with the clinic, as usual, and as I always saying, please say I am one of the doctors here. Full stop. I am Dr. Abdullah, one of the doctors here. Whatever your position, whatever your department, you don't have any mistake by mentioning that. Once you said I am gastroenterologist, it's a mistake of jargon. And once you mention I am a resident, it's not the resident. You are not the resident here, right?
Yeah.
The scenario mentioned that you are the registrar, right? No, it was resident. Sorry, it was resident. Yes, sorry. But what I mean, if not mentioned as resident, and you mentioned the opposite, you confuse yourself, and even you were hesitant to say the resident or registrar. That's why I felt it's not resident. Okay, let's go to the other comment. You start explaining the side effect of the colonography with a very risky and very dangerous complication, which is cancer, right? You said to him the radiation can lead to cancer, which is very difficult to start convincing a patient with alternative procedure with it. Always start with the benefits. So in order to have a look to your gut properly, we have another option. Since you are not tolerating the camera scan, what is the doctor? Please tell me about it. It could be better, yes. Hopefully, it might be better. And the advantage of being or doing this procedure, that we will see the gut from inside and the wall up to the areas around the gut, which is the lymph node. Okay. Not only that, uh, we might check for any small overgrowth or any possibility to be having cancer. I'm so sorry to say that, but yeah, it's one of the benefit.
Also, the advantage also can add also the time. It's shorter than the camera
Exactly.
scan. He can
And
just do it within
yeah,
minutes, maybe 10 for 15 minutes, and he can just
exactly.
go home.
In the same day. Not only that, also it's not uh, discomfortable for you. You'll not feel anything. That just injection, and you'll not feel anything. Let's go to the risk. As you know, or as every procedure, there is a risk, or there is some risk. But don't worry, we will take care of this risk. What are they, doctor? you might have some allergy to this dye. Okay, the contrast is dye, and it might affecting
Dr. Bassem, it's not a
your
dye.
kidney.
It's air.
Uh-huh.
Here it's air. I mean it's carbon dioxide,
Colonography.
not dye. Yeah, it's
Okay, so
the
they will.
tube just inflated with carbon dioxide.
Okay, so it's
So
not
what's
No. I think no. Sorry. I
It's
think
not
that
a dye.
no. We do give. I mean, it depends upon the protocol. So generally, we do give orally either barium or the other one. So
yeah,
I
it's
think that
dye,
is something iodine or barium. I think we give that as
not
well. So yeah, just to clarify, so we give barium or iodine orally because that generally what the concept is that these things basically you are giving orally. They tag the stool, so you know that this is if whatever you find out that it is not something uh, nasty, and then you can pick up any abnormal. So yes, you put the rectal tube in. That is something just to put the air in and inflate the large gut. On the other side, you also give orally either iodine or barium to swallow, and that work as a kind of a contrast. But it is basically to tag the stools, just to differentiate whether this is normal stool or is it something more abnormal. So both of the things are done during a CT colonography. Thank you.
yeah. So I read about it now. Yes, you are inflating, but you are using again a dye. Both of them, Dr. Sarah. It's not only CO2 or gas inflation, okay? So you are inflating along with the contrast you are swallowing. Okay, let's go continue other comments. So this is before you have to be prepared, good hydration, and after, or sorry, during, you will be sitting in the scan room, and we will give you the dye, and you will be scanned with the radiation. No need to mention how much is it multiple, or do you know the X-ray? Why he will know the X-ray? Okay, don't give evidence of something which is difficult to understand. So don't tell him it's X-ray, but multiple X-rays. Just
Yeah,
say
actually, it
radiation.
was difficult to understand this
Exactly.
point. If I'm
Yeah,
not a doctor, I mean, if he just anyone,
yeah.
he will
Not
not
everyone will
understand
know the
anything.
X-ray. Yeah, not everyone knows the X-ray. So the easiest is radiation. Okay, some radiation you will be exposed to, and it will show us all your gut. You mentioned the back passage as the area. It's not the back passage. Back passage mean the stool, okay, or the parts the stool coming from. But you are drawing all the colon, okay, Dr. Abdullah. So it's good to practice this scenario to correct all this information and data in order to do it properly in the exam. Both the exposure, you have to be monitored. You mentioned all vitals, heart rate, blood pressure. So why the patient will know all these things? He should be observed. That's it. What are the monitors? We will monitor all of your vitals. No need to mention vital. Even we will monitor you. I will not say vitals at all. We will monitor you, keep monitoring you for a while before leaving or before going home. Then after, yeah, the consent. Whenever you are agree, please sign out this sign please this confirm the consent form. Read it carefully. Whenever you are agreed, let's do it. Any concern, and of course in between you have to ask understanding. Procedure, again, one of the easiest task. Even if you explain it wrongly about the technique, or using the contrast, is it oral or the inflation, if you don't know in details what is it, but if you explain the steps, they can give you good mark. Okay, try just to avoid the jargon, please. Simply talk in non-jargon way, like you are talking to someone, in a neighbor or friend. This is what I always advise to do. The social support here also, you have to talk about not only the support who's living with you, even the job. Maybe he's exposed to radiation in his job, and it carries the risk of having a cancer. Maybe he's exposed to chemicals, the alcohol itself, the diet. Here you can speak about diet. Maybe his dietary habits are not regular, and he's taking junk food, spicy food, and which is expected to be trigger for cancer. What I mean, try to address those things. If you don't know even the contrast, try to fill up the time with these things. It might help the patient to understand, and of course, you address the social well. Okay, Dr. Abdullah, I hope you can practice one more procedure with anyone or any partner. If even the only the procedure as pre, during, and after, that's it. If you do so, be ready for the exam.
Okay, thank you.
Okay, thank you, Dr. Abdullah. Quickly, the comment, Dr. Ala. Dr. Ala, can
Yeah.
you explain? Yeah, this is the previous. Dr. Hisham, this is low dose scanning. Radiation dose is quite low. Give brochure about the procedure exactly. So don't give the disadvantage for the alternative initially. Is it like a fatal mistake? Once you start to give the side effect or the possible unwanted effect before giving the advantage, the patient will tell you, no, 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 doctor. What you want to do for me? I barely accepted the camera scan. Now you are giving me another option, which is also having a risk. What risk? Risk of cancer. Oh my God. You are like killing him. Okay? Yes. Okay. I hope you got it, Dr. Abdullah, and I'm so sorry to be in such way because the exam is near, and I don't want to be doing such mistakes in your exam. Anyone has comment, please?
Yeah, I think that, I mean, the golden rule obviously is that, Dr. Abdullah, when you are outside, and this can happen obviously to anyone, and if you have not practiced or have no clue about the scenario in a way that, as you said, that you haven't practiced anything like that before, so just go to the simple rule as Dr. Basim said. First of all, read the scenario and see that what exactly is your task and what kind of scenario is that. So if you know that, we discussed the other day as well, there are 4 5 type of scenarios. So here it is just, I mean, by reading the scenario you know very well that it is a scenario about a procedure and you need to explain the procedure. So whenever you are going, just follow those things and follow the format, like what exactly initially explain the procedure, then pre-procedure, what the patient need to do, how the preparation would be, the consent and all these things, what to expect during the procedure, what to expect after the procedure, even if you don't know, but you know that, I mean, obviously you know very well, and you mentioned in your conversation as well that this is a kind of a CT scan, and this is a kind of CT scan which is an alternative to the colonoscopy. So I think that if you can just even explain that it is a kind of an imaging, and obviously it is less invasive. So just tell the positive things, positive aspect of the procedure. If you start that the radiation dose will be very high, and so this means that you're not trying to convince, rather you want the patient to run away from the procedure. That is not the task, and obviously that will not go well with the examiner. So just try to tell the positive that okay, the initial plan was to go for that camera test, but because you are unable to tolerate the preparation, which can happen at times, sometimes people they are unable to do the full preparation, and that's the case with you. So don't worry, that can happen. So we discussed ourselves with the consultant as well, and we feel that as an alternate option, we can go with this kind of a special, you can mention a special imaging technique, which is a kind of a CT scan, and then explain a little bit more that how it is done. Even if you don't know about the procedure, don't go into things. I mean, you can ask that I can, so you just can put it like that, that there is a complete kind of a preparation. I'll give you the preparation brochures that will contain all. So just try to don't give false information, because if you'll say even like that, and if you don't explain that there is going to be a rectal tube for some time to inflate your gut and will put, so even if you don't know about that, you can just put it like this, that I will give you the brochures about the procedures, that how the preparation will happen and how it will go. So that will also be taken. So as long as you are not telling the patient anything wrong and you are offering support, yes, it can happen sometime, a lot of time. I mean, we don't know about the specialty. This is a kind of a specialty related, and if you are a general medicine doctor or any other specialty, you might not have ordered, or even if you have ordered, you might not have prepared, because that's what generally happen. So my point is that as long as you follow those guidelines about the type of scenario and what are the steps, so pre-procedure, during procedure, after procedure, and just all these, just it's kind of just ticking the boxes, and at the end you can effectively tell what kind of support is available, and how you can. So basically they just want to make sure, in the exam scenario, it is communication scenario is not about your clinical knowledge. Clinical knowledge is being tested in station 2 and 4 and in other scenario. Here it is mainly the communication. So they are not expecting that any one of us going for these scenarios that you are going to give each and every detail of the CT clonography, how it is done. So it's just how you communicate. So a lot of time it happens with us practically as well, that we don't know about any procedure, because there could be, for example, if you come across someone who has an atrial fibrillation and you are referring for electrophysiological studies, so you might not know that how it will happen. But again, as long as you're following that pattern, following that step, so there's a very good chance that you will still score very good marks without even knowing the procedure. So it is not a knowledge test, it is basically how you communicate. That is why it is called a communication station. So just make sure that you stick to those kind of guidelines, which are for a procedure or anything. I mean, so this scenario was a procedure. You might get another scenario, like a breaking bad news, like the previous one, or something more. So as long as you are sticking to those principles, those 5 6 things which we have discussed recently, and obviously we keep on discussing as well, I think that you are still going to get very good marks in that. Yeah, thank you.
Yeah, thank you, Dr. Hasham. I will add only to your comment that the communication station is 16 marks, right? 4 of them for clinical communication, how to communicate, how to ask, to address, how to respect, how to introduce yourself, how to ask the question, to stop in between, all the things, and 4 marks. Then 4 for the welfare, if you maintain the welfare of the patient. 4 for the concern. 2 minutes left. You have to answer every concern and to address all the concerns throughout the scenario. 4 marks only for the clinical judgment, which
Judgment.
is
Yeah.
the procedure. For example, even if you don't know the procedure and you follow or you walk through these steps pre and during and after, you can gain 12 out of 16, which is good, very, very good mark in the communication skill.
And
Of course,
Dr.
maintaining the
Basim, they
other
are
skill.
not going to. My point is that even with those 4 marks,
Exactly.
even if the procedure is
Yeah.
not being explained, even then they
Yeah.
are not going to
Yeah.
give 0. They are going
They
to
can
give
give
2 marks. Mostly they are
exactly.
going to give two
Yes.
marks. So this is what I'm trying
Yeah.
to
As
say.
unsatisfactory. One here and
Yeah.
one there. Yeah. It could be 1 mark and 1 mark from this examiner. So it will be, for example,
Borderline.
14 out
I
of
mean, it will come
16.
as a
Yeah.
borderline that he
Yes.
explains
As
some but not
14.
all. Yeah.
If he maintain other skills. So it's don't be panic whenever you see a procedure which you don't know. Just follow the steps, the consent form. If you mention it, it's one of the essential, and it will be fatal mistake if you miss it. Okay, definitely you will be minus if you didn't mention it, and of course in the clinical communication. Okay, thank you, Dr. Abdullah and Dr. Sarah. Hopefully, your exam will be easiest, Dr. Abdullah. Do your best. Best of luck. And again, if there is opportunity to practice again in the coming days, please attend. You might be having another opportunity. Maybe someone will be apologize. I will give you the priority because I know your exam is next Friday, right, Dr. Abdullah, or
Yeah,
next Saturday?
yeah, yeah.
Friday.
Friday. Thank you. Yeah.
Okay. So do your best and try to relax the day before the exam. Don't think more, but talk in a polite way, fluent more, answer quickly the concerns. Hopefully, we'll pray for you. Inshallah, it will be a good exam. Doctor, I
Thank
had
you
a
so much.
question. Yeah, you're welcome, Dr. Abdullah. Anytime you want anything, just message me. I will be there. Okay.
Thank
Doctor,
you.
I had ask a question out of curiosity. outside the case, could you mention types of communication scenario, please? Okay, quickly, Dr. Ahad. Counseling, 3 types of counseling: complication, disease, medication. Okay, these are the possible counseling type. Then there is medical error, clear. Then the palliative and the end of life care, and one more. Yeah, DNR, for example. These are the possible for the palliative and the care. Another procedure, a lot of procedure, lumbar puncture, the pacemaker, ICD, like our scenario CTs, any procedure you can consider as a task. The medical error, all the types of medical error you can find, like medication wrongly. Also, there is uncertainty. You have scenario which is not clear as a mistake, but there is something not clear. Still, 50-50, you can do this scenario as not a mirror, an error, and not a complication. You have to know more and to analyze more to know what exactly happened there. Yeah, I think these are the types of communication in PACES mostly. And there is a lot of sessions, Dr. Ahad. If you go through the YouTube channel, you can have them. And recall, there is also a group for the practiced cases. There is communication skills station only sessions. So you can find the commonest, and you can scroll through all of them to find the most common and the practiced one. Okay. Yeah, I think Dr.
Thank you,
Hisham
Dr.
works for you. Yeah. Ethical legal issue. Okay, you can add also best interest, breaking bad news, cancer, disease counseling. So almost similar. Okay. Thank you, Dr. Abdullah and Dr. Sarah. Thank you, Dr. Hisham.
Dr. Bassem,
Yes.
please, for this here procedure, this is medical error, not good prepare, or this is only
No,
because
no, no,
of
no, 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 nothing.
abnormality in the bowel
Yeah,
of
yeah.
aorta?
It's something technical couldn't be done. So I found another alternative. It's not error or something. It's not complication even. I couldn't do it. So I find out another solution. So no error at all here.
No need to apology, no need to. Okay,
No, no need. Why you apologize? It's not a mistake. Okay.
okay, 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 thank you.
Okay. Thank you, doctor. Difficult in preparation for procedure. Yeah, that's it. So it's okay. Nothing to be apologized for. Okay. Thank you, everyone. See you tomorrow, inshallah, with the long clinical consultation day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Walaikum assalam.